Hi, welcome to Health's Pelvic Power Hour. I'm Helen, and with Kirsten, we're the co-founders of Health. We're here to demystify pelvic health, break that silence, and get real about your pelvic floor. We have insights from medical experts and holistic practitioners, but we're here to empower you with the knowledge that your body deserves. So in today's episode of our Pelvic Power Hour, we're diving into that vital intersection between menopause, pelvic health, and whole person well-being. We have a very special guest who brings both medical expertise and a deeply human approach to women's health. We are honored to welcome Dr. Colette Edwards, MD, MBA, founder and Chief Medical Officer of Pausitive Health. Now, Pausitive Health is a holistic destination for women navigating that menopause journey. And Dr. Edwards brings a really, truly integrative lens when it comes to combining education, care, community, and all the tools that support women during one of the most transformative stages of life. With her background that spans Harvard, Wharton, and clinical medicine, as well as training in wellness coaching and health equity, Dr. Edwards has spent her entire career bridging that gap between conventional healthcare and the kind whole person support that women actually need. So in this conversation, we'll explore how pelvic health shifts during menopause, what women aren't hearing enough about in traditional care, and also how we can reconnect with our body's sexuality, our vitality, and make this truly a powerful midlife season. So let's get into it.
Dr. Edwards, welcome to Health's Pelvic Power Hour. We are truly honored to have you here today. You bring such a rich and thoughtful approach to women's health, and I love to start right at the beginning. What's the origin story behind Pausitive Health, and what inspired you to create this space for women?
Thanks so much, Kirsten. I really appreciate the opportunity to be on the podcast and to collaborate with the two of you. So I started exploring the area of the menopause journey when I had a friend who was going through menopause. She actually recognized her symptoms as being associated with menopause, which many people don't, unfortunately. And she had actually figured out on her own some things that worked for her, and she was tooling along and was pretty satisfied with the way things were going. Her PCP and her GYN, however, had other ideas, and they kept wanting her to go on hormone therapy. And this was at a time when the women's health study had come out that has subsequently been corrected, but at that time had been misinterpreted. And basically, you got the message, if you were a woman or even a provider, that hormone therapy was quite dangerous, and most people were taken off of it. The use of hormone therapy actually plunged about 80% back then. And so it got to the point for her when she went to her GYN that he actually got quite angry with her that she would not go on hormone therapy. And so, as you might imagine, that was the end of that relationship. But when she told me about it, my mouth dropped open. I don't get shocked very frequently, but that did do it for me. And then I began to wonder whether or not that was just a fluke in her particular instance, or if it was more widespread, and what information was actually out there for women to find out about the menopause journey. So I did some exploration, I did some market research. I found out that that was not a fluke, that it was actually a quite common experience for women to have a less than satisfying experience, we'll put it that way, and that they felt that they were unprepared, that the whole menopause journey experience came out of left field, and that they were not getting a lot of satisfaction when they went to physicians in many instances, and even sometimes for being gaslit. So that really stirred my interest, and that's how I got on this pathway.
Yeah, and I think that is a very accurate point in that, I think for many women, it's a very confusing time. It can feel very isolating. It's the first time for many that you're even hearing about the menopause. And for those who are just starting to come into this phase of life, can you tell us a little bit about what the menopause journey is really about? And also, secondly, what are some of the key things that women really should know or need to know?
So first of all, I'll start off with a definition of what menopause actually is. And it is that point where a woman has gone 12 consecutive months without having a period. Now, things are a little bit different if you've had your uterus removed or if you're on certain medications, because then you either can't track your periods at all because you don't have them anymore, or you can't rely on them. But that's the definition. I think that a lot of people may have a stereotypical view that this is something that happens in their 50s and that women have hot flashes and mood swings, and that's all there is to it, when there is so much more. This is a normal, natural stage of life. It's a transition. It's not a disease. And women have options, and they have ways of getting their symptoms addressed so that they can take control, not only of the symptoms, but also their health and well-being in general. There are a lot of women out there, Helen, you had mentioned this, that are out there suffering in silence because they think they are the only ones. It's a taboo topic often. And so for some people, there may be some shame associated with it, and they may not have the information that there really is help out there. So they feel very much alone. In terms of the symptoms, this is a time where estrogen levels as well as progesterone fall significantly, and the entire body has estrogen receptors. So you can then imagine there is a wide variety of potential ways that menopausal symptoms may show up, both physically and mentally. So in addition to the symptoms that I have already mentioned, it's common for women to experience weight gain, issues with sleep, joint aches and pains. Brain fog is a common one. You may develop depression or anxiety where you've never had that before, or if you've had it in the past, it becomes much more difficult to manage, or an episode may be triggered. And the other thing is that because of the hormonal changes, the risk for several chronic conditions also increase. What has also been found, and I think this is really important for women to hear and take into account, is that your mindset can have a big difference, make a big difference in terms of the experience that you have. Now, it's not 100% guarantee, it's not a panacea, but studies have shown that women who have at least a neutral, but even better, a positive outlook, or they are in a country or culture where it is viewed as a normal stage of life, it is not associated as a negative. And if it's associated with aging, aging is not viewed as a negative, where women may actually be seen as wiser, sexier, and have greater status. Then in many instances, having that positive outlook can mean less severe symptoms and a much, much better experience. So there's tons of hope, there are tons of options, and this is a time when women can actually become empowered.
Yeah, Dr. Edwards, I'm so happy that you hit on some of the factors that are impacting or can impact women, both physically, but also dipping into the emotional and cultural aspects of what this menopause journey might be like for some women. I'd love to hit on how might a woman's maternity experience, pregnancy, birth, or even postpartum affect their menopause journey years down the road.
And Kirsten, I'm so glad that you brought that up, because it just highlights that it's almost never too early to start thinking about menopause, as crazy as that might seem when you are pregnant, because a lot of what happens during your pregnancy will definitely come back potentially to haunt you, if you will, during the menopausal journey. And therefore, I think it behooves women to really, if they suffer a complication, to do everything after delivery to then address those issues and reduce the likelihood that they will have problems in the future. But for example, there's several complications that women may experience that increase the risk of early menopause, and they include gestational diabetes, preeclampsia, premature delivery, miscarriage, or stillbirth. And the additional significance of going into menopause earlier than the usual time is because of the increased risk of chronic conditions I had mentioned earlier. So if you're starting earlier, that means you have that many more years of increased risk during the menopausal journey as well as for the rest of your life. In the case of women with postpartum depression, which is pretty common, and thankfully there's been much more focus on this area. But if you experience postpartum depression at the time of perimenopause and after menopause, you're at greater risk of depression and anxiety. You may have more issues with sleep, brain fog, mood swings. And related to the sleep issues, then you may experience greater difficulty with the weight gain that some women experience during this time. And another example I would give is that for those who have hyperemesis gravidarum, which is a condition where there is excessive vomiting to the point that women start to lose weight, they may need to be hospitalized. They may need IV nutrition. When perimenopause begins, they may have more problems with GI issues or even more severe hot flashes. So there are different points in a woman's lifetime where hormones come into play. And even though they may not seem to be connected, they definitely are.
I just want to say that this knowledge that you're providing, Dr. Edwards, is like gold, because as someone who went through, I have a son, and I have to tell you that information that you just shared, wasn't part of a kind of pregnancy journey, but it's really important to reflect upon and think about, as you're saying, so that we can communicate better with our care providers and also prepare ourselves for a journey that it will come, a transition that will come for women. So thank you for sharing that.
Oh, for sure.
Yeah, I think that's really a valid point that you've raised. It's never too early to learn about the menopause. And as Kirsten said, learning about things, even when there's fertility years or earlier years, about how it may impact you later in life, I think is hugely valuable to every woman out there. I just want to talk a bit more about the menopause transition and how it impacts on pelvic health, something that we often feel is sort of an afterthought for many women in healthcare. So in terms of the transition period into menopause and the changes of in your pelvic health, can you talk a little bit about what those could be, how they may show up or manifest for a woman?
Sure. And you all obviously are the experts when it comes to pelvic health and pelvic floor disorders. But there is a condition that a high percentage of women experience during the menopause journey called genitourinary syndrome of menopause. And one of the symptoms that may show up is pelvic pain and pelvic pressure. This condition at its root is related to the drop in estrogen levels, and there is thinning of vaginal tissues. So women may have vaginal dryness and painful intercourse. They may also experience UTIs when they have not had them in the past, or more frequent UTIs than in the past. And then they may have symptoms like urinary leaking, with coughing, with laughing, with straining, or they may find that now they have to rush to the bathroom to make sure they get there in time. And so I think that women are more aware of the potential pelvic health implications during pregnancy, but don't necessarily see the link, once again, as we stated before, of how it may show up or become exacerbated during the menopause journey. So once again, kind of linking back to pregnancy, not too early to think about the actions that you take during that time if you're having pelvic floor issues, because the work that you do then to address them will pay off in the future when the hormonal transition may try to take you back to symptoms you don't appreciate. I'll put it that way.
Absolutely. I can feel myself doing pelvic floor exercises as we're speaking. It's always like, oh God, it's like a subconscious thing. You start thinking about it like, oh.
Well, and I think that the other thing is in terms of pelvic health, and just in general, there are lots and lots of clinicians who have not had adequate training when it comes to the menopause journey, and in addition to that, and on top of pelvic floor. And this is an area that both patients and clinicians can be queasy about. And so that is like a double whammy if you feel that you can't bring it up, or if you do, you get signals of queasiness from your clinician. And I just say that you're the one who's suffering. And even though you may feel embarrassed or ashamed, or that you want to make light of it, you really do need to bring it up, because once again, there are options and there are companies like Pelly Health that are out there to help you. So don't suffer in silence.
100%. I think we couldn't agree more on that. I want to talk about menopause in a different light. We hear obviously a lot of things we need to be aware of, but it's also, as you mentioned earlier, it's a time of empowerment and a time of opportunity for women. Can we talk a little bit about the opportunities that, given the right support, awareness and education like you're doing at Pausitive, how can that bring opportunities for women during this period of their life?
So the menopause journey is a time, I think, where women have a chance to really think about what they want and need for the rest of their lives. They're kind of at a crossroads. I won't call it a midlife crisis, because I don't think that that's what it is. It just seems like it would be a natural time to start thinking about the future. And thankfully, it's a time where there are huge opportunities to invest in yourself, to invest in self-care, and take the bull by the horns and really advocate for yourself as you navigate the healthcare system, because the time spent thinking about what you want and need, the time spent taking action around a healthy lifestyle and reducing risk factors for chronic conditions, both physical and mental, will pay off for the many years ahead that definitely can be vibrant. And there's no reason to think that that's not possible for you. As I had mentioned earlier, there are some women who have that outlook. There are cultures that have that outlook. And so I always feel if someone else has been able to do it, then you have a high likelihood of being able to do it as well. And it can make a big, big difference between misery or seeking help, misery and getting support and connection, misery and taking control, which in and of itself can result in a very positive feeling that then has a ripple effect. Women are under a lot of pressure during this time. So besides work, they may have children on one side and aging parents on the other. It's also at a time where their careers may take off, so they have greater responsibilities. And everything that a person can do under those circumstances to take care of themselves and not keep putting themselves on the back burner will help in all aspects of their lives. There are also women who see not having a period anymore and any pain that may come with that as a relief. and liberation. There are many women who may not want to have another baby, but by the same token, and then feel a sense of relief about not having to worry about getting pregnant after they've passed that day of 12 months without a period. And I really emphasize that because during the perimenopause, when your periods may become irregular, it's important to recognize that you still can become pregnant. So I know several people who have had unexpected news during this time. So if you think that that is not something that you want in the cards for you, then to take the necessary precautions.
Yeah, I think it's, as someone of that age, I definitely know that it's a time when I can't eat the same way that I used to, or I do need to, put myself back up on the agenda in terms of healthcare, because all those external pressures that you mentioned, for many women, just, you put your health at the bottom of the rung and you're not as young and as vibrant as you were in those earlier decades. So you need to take more conscientious effort about your health and lifestyle. So yeah, 100%.
Well, and Helen, with what it is that you're thinking about, I think from a mindset perspective, that it is very common and understandable for women to potentially have some grief and mourning around this stage of life. And also women may feel a sense of betrayal by their bodies and a longing for things to be the way they used to be. But I think that they would be better served for really working on trying to let go of longing for the old you and really taking the actions necessary to build and support the new you, who is a fantastic person, and to remember the true essence of you has not changed. It's just an opportunity to bloom even more and step into your power rather than focusing energy on the past, except for what you can learn from it. Much easier said than done, but it's worth giving it a try.
Love that, 100%. And Dr. Edwards, you alluded to earlier in our conversation about the cultural differences in the way that menopause is viewed and approached. Can you give us a couple or an example of something that you've seen from another culture or where you feel that it's been a positive view or take on how menopause is viewed and approached?
Sure. So one example I would give is that in several different cultures, there's actually not a word for menopause at all. In some cultures, like in Japan, the word that is used for menopause actually means renewal and transformation. So you can see how differently some people, some cultures, some societies look at this stage of life compared to what is often the case in this country, where this time of life is tied to age. Age is tied to something that you don't want to be. So rather than looking at getting older as something that is a blessing, there's more of a focus to try to stay young for forever, which obviously is an impossible quest and doesn't really serve people well. So once again, I think that when you learn from other people, including outside of the country or culture that you have been living in, it's important to note that if you are coming from a more negative place or have actually internalized negative societal messaging, to think about other places where women are going along about their way, living their lives, and are thinking about things very differently. And France is another example I would give, where getting older for women, often they are thought of as being sexier and wiser, and having experience that is valued. So if other people can do it, you can too.
I love that. We're going to borrow from the places that are celebrating this journey. Thank you so much for sharing those examples. Dr. Edwards, before we wrap up, can you tell us more about Pausitive Health and where women can go to learn more and a bit more about what it offers?
Okay, I'd love to do that. So, the vision and the idea behind Pausitive Health is that it would be a one stop destination where a woman could feel seen, heard, understood, and get the help, support, community care that they need and deserve over what can be many, many years of symptoms, and not need to have 12 different apps on their phone, and feel that in terms of education, different people have different learning styles, and that there is something there regardless of your learning style, and that you do have control if you decide to take it. It is a place where you can learn about medications, both hormonal and non hormonal, as well as information about integrative modalities like acupuncture and herbal medicine, and a host of other options that women have to address their symptoms. Because once again, for me, it's really important that people know about the vast array of options that are out there, because for some of them, the likelihood of hearing about them from your clinician is pretty low, because simply they aren't going to get that training in school or during residency. And therefore, they can't bring up something that they don't know about. As part of the experience, there is also additional information and a much greater focus with regard to women of color and those who are members of the LGBTQ plus community, because they may have a different experience than other women. So, for example, Black women tend to have more severe hot flashes, and their time of symptoms lasts much longer, as opposed to the 7.5 years or so when of perimenopause. It may be 10 years for them. And the severity of the symptoms can have implications like a greater increased risk of heart disease, a greater increased risk of dementia. Finding a clinician who is versed both in menopause care as well as unique differences that may exist if you're a member of the LGBTQ community may become a compound problem. With regard to things like stress, depression, anxiety, women have access to digital cognitive behavioral therapy. One of the big complaints that women report during this time is with regard to weight gain and weight management. So at Pausitive Health, they can take a diet assessment that has a trackable score that they can look at over time. It's focused on food quality and a nutrient deficiency, and they can get personalized recommendations for the type of eating pattern that is a fit for the goals they've stated, as well as the library of recipes. If they have musculoskeletal issues, so aches and pains in their muscles and joints, that now has an official name as of last fall, musculoskeletal syndrome of menopause, then they have access to a virtual consultation with a physical therapist trained specifically in that, as well as a library of 3,000 or so videos of exercises that address that pain and get personalized over time for that specific person, as well as access to physical therapists that are trained in pelvic floor issues. We also have a community for people to come together and share their tips and woes. And we have a webinar series, a podcast series, and a newsletter. So we try to cover as much as we can to help women get to a state where they know they have options, they know what their options may be, they are prepared to get the care that they need and know the questions to ask. They have access to care, including to menopause trained clinicians, and they will have support in shifting their mindset and taking action both to address their symptoms now as well as to prepare for the future, which from my perspective can be a very, very vibrant time of life. And really understand, do not suffer in silence. You are not alone, and to take action because there's no reason to live in misery.
Well, we absolutely love what you're doing at Pausitive Health. In a world where things are so fragmented or you don't know what to trust because there is a lot of misinformation out there, to have a place where women can go and get a variety of options. You touched on holistic options and medical options. Really helping women truly understand their bodies and the menopause journey is absolutely critical. So thank you so much for joining us today. Thank you for the work you're doing. And thank you for bringing so much clarity and compassion to a topic that women truly are craving more support and more information on.
And I just forgot to mention, for women to learn more, they can go to pausitivehealth.com, and Pausitive is spelled Pausitive, Pausitive health.com. We actually have a pilot program in place that will run through the end of June, and much of what I have mentioned is actually available for free. And I want to take the time to thank you, Helen and Kirsten, for having me on, and grateful for our collaboration. And thank you for having been on the Pausitive Health podcast, and that episode will be dropping this month.
Wonderful.
It's been our pleasure to collaborate. It's a fantastic platform, and we're really pleased that we can collaborate and get this information out to women out there. Thank you.